Hello and welcome to Trio Tuesdays. I'm Colleen Rather, physician assistant, founder of Trio, and your host for Trio Tuesdays. Today we're going to go over some frequently asked questions about stopping Ozempic. The first thing you're going to want to talk to your provider about when considering stopping Ozempic and GLP-1 medications is your reasons for stopping. This might be that you met your weight loss goal, or your glucose is under good control, and you don't feel like you need the medication lifelong. This could be concerns with side effects like GI side effects, nausea, vomiting, constipation, bloating. It's also going to be important to discuss your plans for how to manage your weight after significant weight loss. These medications can help people lose a significant amount of weight over time, but if you haven't put in a lot of hard work to learn how to eat healthy, get your protein intake in, get exercise to be part of your daily routine, it's going to be very difficult to keep that weight off without the medication. And so discussing with your provider about what your next steps are, that could be referral to a dietitian or nutritionist, that could be exercise coaching, some physical therapy if you've got nagging injuries that are preventing you from exercising, or somebody that can help you transition into maybe other medications to help manage your weight while you're learning how to eat right and exercise. Another question to ask is, are there any risks to stopping Ozempic? In the immediate sense, no, there's not a lot of risks to abruptly stopping the medication. You don't necessarily have to wean off of it, but you do need to consider what you're using it for. If you're using it to manage your blood sugar in type 2 diabetes, you need to think about how you're going to manage your blood sugar without the medication. So what can happen after you discontinue it is your blood sugar can start to rise over time, and you can see that reflected in your A1C. Remember, an A1C is a 3-month average of your blood glucose. So this is a good big picture of how well your diabetes is managed. If you're using GLP-1 injectable medications to manage your weight regain is common, and it is a risk of stopping the medication. So like I mentioned before, having a plan in place for how you're going to either wean off the medication, learn to eat right, get your exercise habits on board, and really get those lifestyle factors on board in order to maintain the weight loss. Speaking of weight gain after stopping GLP-1 medications, like I said, it is common. They did do a study called the Step 1 study where they followed participants on GLP-1 medications for about 52 weeks. And the GLP-1 group in the study did lose 17% of their body weight, which was a significant amount of weight loss. And then they followed them for over 1 year after the study was done, and they found that 2/3 of the population of those patients regained the weight back. So this really highlights the importance for a transitional program or transitional therapy to help people maintain that weight that they lost, possibly lose more weight over time if they wanted to, or start to consider other medications or other therapies in order to help them transition off of these injectable medications. Some ask if they can replace their injectable GLP-1 medications with other medications to help them wean or manage their weight long term. The answer is yes. There are several other medications and therapies that we can use to either help wean off of GLP-1 medications or to transition you from them to another type of weight loss medication, or medications that help address other barriers to weight loss and weight gain, such as emotional eating, depression, anxiety, compulsiveness, overeating, alcohol intake. There are a lot of reasons why people struggle to keep their weight off, and there are other medication options out there to help them maintain that. So what kind of follow-up care should you expect when you are done taking Ozempic, Wegovy, Mounjaro, or other GLP-1 medications? First is accountability follow-ups. We want to make sure that you're not regaining weight. We want to make sure that your blood glucose is in check. And those follow-ups ideally should start every 2 weeks to every 4 weeks after discontinuing the medication. This kind of follow-up allows us as providers to make sure that you are tracking your blood glucose, tracking your weight, implementing lifestyle changes, getting the exercise in, getting the protein in, and that way you can learn over time to do this on your own without needing a lot of involvement from your provider. That is it for today's FAQ on how to stop taking Ozempic. If you have any questions, leave them in the comments. As always, we appreciate likes, shares, and subscriptions. And for more information, visit our website at mytriofit.com and on Instagram or Facebook at mytriofit. See you next time.